Hello and welcome to Dragon Bytes, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bytes. This week we're going to try and introduce the complex topic that is sustainable healthcare and explain why it's important for us to be aware of as paediatricians. Two of our Dragon Bytes hosts, Dr. Stacey Harris and Dr. Tom Cromarty, are joined by two local trainees with an interest in sustainable healthcare. First, there's Dr. Rosie Spooner, who's one of the paediatric trainees currently in the Severn Deanery, and then there's Dr. Amarantha Fennell-Wells, who's a dental trainee in Wales. Both Amarantha and Rosie are taking time out of training at present in order to undertake different projects in the realms of sustainable healthcare, and they've been kind enough to take some time out of their busy schedules to come have a chat with us about it. This is the first episode in a two-part series. Anyway, let's get started.
So welcome everybody. So my name is Dr. Stacey Harris. I'm one of the paediatric registrars and one of the presenters for Dragon Bytes. And we've also got Tom Cromer, who is one of the paediatric trainees in Wales and also one of the presenters in Dragon Bytes. And we're delighted to be joined by two amazing people who are doing some great work in sustainable healthcare. And so we've got Rosie Spooner and Amarantha Fennell-Wells. I wondered if you'd mind introducing yourself. Rosie, would you like to go first?
So thank you so much for asking us to come along to this podcast today. So my name's Rosie Spooner and I'm a Paediatric Trainee in the Severn Deanery. I've taken a year out of training to go and work at the Centre for Sustainable Healthcare as a QI Education Fellow, which is a Health Education England funded post. And essentially what my job is going around explaining about how we can practice more sustainable, ethical healthcare using quality improvement as a tool to do so.
Amazing, thank you. Amarantha, would you like to go next?
Yeah, thank you so much for having us. My name's Amarantha Fennell-Wells. I'm a dentist by background, and I'm in a weird limbo position between core training and registrar training, and saw this fellowship, which is a Welsh Clinical Leadership Fellowship, jointly run by HEIW and Cardiff and Vale Health Board with funding from the Centre for Sustainable Healthcare. I'm spending my time being a new fellow, working out what I need to do because there's so much to be done. And it's been a bit of an endeavour working out where best to place myself strategically and what kind of work I should be doing. So it's been a steep learning curve, but I think I'm finally settled in a couple of projects to do. And I've shared a few things with Rosie, which has been really nice having that support. So yeah, thanks for having us.
Great. Thank you very much. So I thought we'd start off by just talking about what is sustainable healthcare.
That's a really good question. So I could give you a small book definition and then go probably into more about what it means to each of us. So the definition, the goal of sustainable healthcare is to meet the needs of patients and populations of the present, the people we're treating and looking after now, but without compromising the ability of future generations to meet their own needs. So it's about understanding the value of what we're doing now versus not taking away from the people who will follow us. That's kind of the book definition, if you will.
Yeah, and as paediatricians, that has particular significance because the future generations are the people that we're looking after, and their ability to run a national health system in the future will slightly depend on how we, as health professionals today, act in sort of sustainable ways. So yeah, I think it has particular significance for those of us who work with children and who have children. And I think that's probably been part of my core desire to get involved was after having had my own kids. I sort of really started hearing much more about sustainability being a really key and important public health issue for them and for their future. And I think we can all say that we understand how important planetary health is, having been sort of exposed to a lot of what Greta Thunberg and student strikes has been, and you don't need to watch David Attenborough too much, but you kind of get the message. It's pretty important. And so, yeah, that's kind of leads into the whole idea of sustainability as well.
Yeah, it's so important. That's what I always think, is I think it's like the children that I'm looking after, and their children and their children, and my great grandchildren. We have to start now, don't we? Great, thank you both. So we hear a lot about the climate crisis, and but why is it so important? Why are we sort of trying to do something about it? Rosie?
So why is the climate crisis so an important thing for us as health professionals? Well, very simply, the climate crisis is the biggest public health threat to all of us in the 21st century. And the Paris Agreement that has set targets to reduce carbon emissions to sort of net zero incrementally over the next 30 years is so important, because if we don't, the kind of temperature rises that we're likely to see are sort of almost at the point of non-compatible with life as we know it. And that is not meant to be over dramatic, but it is really, really worrying what we're experiencing already, and it is affecting people's lives in both this country, but particularly in some of the poorest countries of the world. They're really experiencing some of the very detrimental effects of unstable climate, and that's really, the climate emergency as a health emergency can't be understated as a really important issue. But saying that, it sounds very doomist and apocalyptic and all very bad. But actually, a lot of the solutions are, if you put health at the very center of them, they're both really positive. So you can really kind of make healthier communities that both will have wins on a kind of environmental level, but also on a healthier lifestyle level. So doing those two things together should be seen as like a really great opportunity. So it's the biggest threat, but the biggest opportunity.
Yeah, that was a really great way to put it, Rosie. Thank you. Did you have anything to add, Amarantha?
Yeah, to put it into perspective, the things that are happening that appear in the news, forest fires, flooding, droughts, is that in isolation, those episodes are awful, but we have to recognise as well that those groups of people who are affected are also seeking healthcare. They are seeking addressing of their wounds, and they're moving into different population areas that aren't as affected by those issues. So it's not just that those terrible things are happening, is that we're having to mitigate the care of those people for the things that are happening, in due course putting more pressure on our health systems. And then if you look at the health system and its impact on the climate crisis, it's not without blame. And that's what we're looking to address and investigate, is that whole circular nature of the climate crisis, its impact on health, and health's impact on the climate crisis. So if all those groups of people individually are looking at what's happening, that's that cohesive teamwork and collaborative working together is the idea behind working towards these net zero goals that we've committed ourselves to as nations, as countries, working towards addressing those terrible things that are happening to the poorest populations, the ones least responsible for the effects of climate change, the ones most vulnerable to its effects.
Yeah, it's quite staggering. So there's a map that I've seen where you see the amount of carbon that it's mostly Westernized world produces, and then you look at the map of who it affects, and it's completely reversed. And I think that is absolutely staggering, really, isn't it?
You mentioned about the effects of kind of the healthcare industry. Can you just go into a bit more details about how, I suppose, the NHS is a big organisation and its impact on health?
Yeah, so as an organisation, we are healthcare providers. We're not health providers. Health is determined by so many wider determinants of health, right? But as a health industry, the whole of the healthcare sector produces about 5% of the UK's carbon emissions, which is approximately the same as the number of aeroplanes leaving Heathrow, departing Heathrow annually, like prior to the pandemic, which is massively reduced at the current rates. But if the healthcare sector was a country globally, so if you put all of the health systems of the world, it would probably be the same as the 5th largest carbon producing country in the world, so just under Japan as a sector. So, you know, there's been a lot of focus on the fashion sector, there's been a lot on the kind of aviation industry, but not many people really consider that healthcare is contributing to climate change, whilst also going to be experiencing the huge effects of climate change. So what does that mean in terms of where those carbon emissions are coming from individually? There's the kind of direct effects from some of the products that we use, but there's also smaller kind of sections like travel within the NHS, food within the NHS, buildings within the NHS, and all of those have been mapped out, and we're the first health system in the world to do that and set a target of how they're going to be reduced over time. But focusing only on carbon emissions misses the wider kind of environmental issues as well. So the health sector was a really a major contribution of mercury in the past when we used to have thermometers, and that's been massively phased out in the last 30 years. So that shows us that the health system can change and can reduce its environmental impact. Still mercury is used in thermometers in a lot of places in very low resource settings, but that mercury ends up leaching into water systems, and mercury poisoning has been affecting as a public health issue. So yeah, the health system has climate effects, but it also has plastic pollution, it also has air pollution effects. So we need to kind of think about all of those issues, not just carbon emissions.
Right. And I think there's also some aspects of where we get our equipment from as well, and taking some responsibility about, you know, the practices where those instruments are made, or whatever it is, which sometimes kind of goes not thought about to the people who are using them so much.
Yeah, I mean, I think it's similar to kind of cheap fashion. And, you know, when you go to a shop and you buy cheap fashion, you know, there is become an increasing awareness that many of the people that have been involved in the supply chain of that product have been not given the kind of standards of work practice or any practice that you would expect people to be part of. And I think there's been some exposure in the past that some of the instruments that we are using within our health system have been produced by involving child labour, for example, and very kind of poor workers' rights in many countries of the world where they're produced. And there's something called the BMA ethical, or what's it called, Amarantha? Do you know? I'll put it at the end of the podcast, but there's a great resource and a video led by Professor Mahmood Bhutta, who explains some of the ways that we can help to produce more ethical and sustainable supply chains within the NHS.
Amarantha, I was going to ask before, in Wales specifically, isn't there a bit of legislation or something towards future generations that's quite important?
Absolutely. The Welsh Government has produced this incredible piece of work called the Wellbeing of Future Generations Act, and it was brought into effect about 5 years ago. And it talks explicitly about Wales's responsibility to its population, but also its global, the global population. So it's all about preserving the cultural, social, economic situation of Wales without sacrificing the well-being of the rest of the planet. And it's really fantastic because it gives us a lot of power. It gives a lot of people in Wales power to ask the questions that Rosie's bringing up, to ask the questions about supply chains and the clarity of all of the processes we're buying into, essentially. And I encourage everyone to look it up because it's got very, very clear pillars about what we should be investigating. And the commissioner of the Wellbeing of Future Generations Act, like I said, does have an incredible amount of power to stop and to question all the things that we're producing at the moment, all the pieces of legislation, all the initiatives. And if it doesn't benefit both Wales and doesn't sacrifice the well-being of our fellows out there in the globe, it doesn't move forward. And it's incredibly powerful.
Great. So it's kind of something we can use to almost hold people account, is it, moving forward?
Definitely. Holding to account is the key phrase. And holding to account the three factors we're alluding to but haven't quite put into words in terms of the triple bottom line, is that currently our processes are very much based on financial value, but we're arguing that sustainable value and sustainable healthcare needs to equally consider its effects on the social issues, our communities, our patients, our staff, our global partners, and also the environmental effects. So it's looking at those three pillars in the equation equally. And the Wellbeing Future Generations Act does actually reference those things in its legislation. So that's putting it into like finite terms. And we're not saying that we should consider one of those factors above the other, but if you look at the picture through those three lenses, the kaleidoscope, you actually come up with a better understanding of sustainable value of a thing or a process.
That's awesome.
Tom, I've just found it's a fair medical trade organisation in the BMA, because we spend about 40 billion a year on procuring services in the NHS. And so that 40 billion shouldn't be used in harmful ways. You know, we need to be making sure that what we're buying and what we're doing is going to have the best ethical standards to it. So yeah, there's a great amount of information on there. So
thanks for looking that up. And that was really interesting, Amarantha, about the triple bottom line there. Is there perhaps an example you can both use of where we can talk about, you know, a specific thing and go and really briefly go into the three aspects and how they might rival each other? Do you have any ideas of that? Just to bring it kind of an example to listeners, you know, a tangible example.
Sure. So there's loads of case studies that are available on the Centre for Sustainable Healthcare's website where the triple bottom line has been accounted for or taken into account. But one particular example I can just come to the top of my head was a project that was done by some nursing and emergency medical staff down in Devon. And what they did was they looked at cannulation in their A&E, and they found that people were just being cannulated automatically nearly as they were coming through the door. And they did a project where they tried to reduce the number of cannulas that were being put in. And you could just say, okay, from a patient perspective, yeah, there's advantages to be had here by not having a painful procedure that you don't actually need. So if we just went on the purely patient above all perspective, that's fine. But they actually also measured from a kind of a triple bottom line perspective. So they looked at what was the environmental impact of not putting in cannulas, how much carbon did they save, how many tons of waste were prevented from going to incineration. And that wasn't a particularly difficult calculation for them to do. They also looked at the financial savings, and they also said, from a social aspect, did it improve the kind of flow through the department, but also was it better for staff members? Did they feel like they had more time to actually speak to a patient rather than, you know, have them immediately arrive and cannula, bloods, X-ray, okay, through the process? And was it better from a patient perspective overall? Was there any adverse outcomes that happened? Was anyone kind of not cannulated who needed to be? So they did a whole project just looking at that in a practical, in a clinical setting, and that had some really positive outcomes overall. I can think of many, many more if you want more examples. There's lots to be had, but
no, I'm sure we'll put that resource in the show notes as well, so that people can access those other examples, because I think they're really useful at letting people understand it more contextually, really.
Yeah.
We're going to move on to talking about climate justice and what that means, especially kind of with the topical racial justice and social justice that's going on and where that fits. I don't know who wanted to start with that. Maybe Amarantha.
No, Rosie's definitely got a bit more than I do on that issue.
Right. Where does climate justice fit with the social and the racial justice movements, or what is climate justice?
Well, we can start with that.
So, what is climate justice? Whew. That is a big old question, but I would say that for me, what you were mentioning earlier about having seen the map of the world, whereby where the biggest environmental degradation has occurred and where the impacts of that environmental degradation are being felt, is a hugely powerful image. So for me, climate justice means trying to take account of both historical and present contributions to the crisis that we're in, and trying to improve, work together both to mitigate and to adapt to the situation we're in. So climate justice involves us making changes to our lives now to try to prevent further damage occurring in the future. To me, that's kind of what it means. And how does that fit in with social justice and racial justice? Well, I don't think that we can try and take any of these justice movements in isolation. They're interconnected, and the sort of idea of social justice being able to be dealt with in isolation to the climate justice movement seems ridiculous. They should work together synergistically to try and improve outcomes overall. So a lot of the poorest members of our society will be experiencing air pollution at levels, for example, that those who are more wealthy and can live in leafy suburbs will not be experiencing. And so if you're going to design something that's going to try to readdress that, you should also be looking at how to try and readdress some of the inequalities overall within the society. So, and in terms of racial justice movement, I think that in this country, we have historically looked at racial justice as more of a social justice movement. And in the USA, they've looked at it more from a racial perspective. And I think there's been a really interesting kind of introspection over the last 6 months to a year on how the UK is actually really talking about race. And, maybe this recent government paper that's just come out about race and social class has been quite interesting for the discussion to further itself. But in the US, for example, if you're a Black person, you're 30% less likely to produce air pollution and 40% more likely to live in an area that is experiencing that air pollution. And David Lammy's got an excellent TED talk talking about the racial and climate justice movements together and how important they are, which I would definitely recommend having a look at.
Great, thank you.
Wow, so it's absolutely mind-blowing, isn't it? I just find it completely fascinating, hearing about it and understanding it deeper and deeper. I'll make a note of the David Lammy and put it on the show notes so that people can access that if they want to. So the other thing that I wanted to talk about, and it's something that I think often gets forgotten, including by me, is the impact of the declining biodiversity. And I was wondering a little bit, why is that important? But then also what we can do in the NHS to help with that. I wondered if you had any ideas with regards to
So, Stacey, do you think people know what the biodiversity crisis is?
I don't know.
What do you understand by it?
So what I understand about it is that there are many species that are becoming extinct. Also, we are including like populations of bees which pollinate the food that we eat, and if that carries on, then we won't have any animals left. We won't have the food chain completely ceases to we won't be able to pollinate the food that we eat. That's what I understand by it, and that we are increasingly concreting over things. Things are like increasingly unnatural, so really the world should be forested, but we've got lawns and we've got non-native plant species and things like that, and So that's what I understand about it, and that to try and help with that, it would be to kind of make places just more natural and more wildlife friendly, and not using pesticides and that sort of thing. That's what I understand about it, but I'm not sure.
No, that's a great kind of certainly the kind of headline thing is there, which is that species are becoming extinct at a rate which is like 100 times the background rate that we have experienced before. So we know that animals have always gone extinct. That's evolution. The dinosaurs went extinct, other animals would have gone extinct, but we are at a mass species extinction. This is the sort of 6th time that the Earth has gone through such a massive extinction rate, and the previous one was led to the extinction of the dinosaurs. So we are kind of going through this really quite dramatic changes, and the causes are multifactorial, but they have one thing in common, and that is human activity. And there's a whole range of ways in which humans are contributing to the biodiversity crisis. And what can we do to try and address that? Well, green spaces and more wild spaces is one particular way. And the Centre for Sustainable Healthcare has got a forest, which it runs within the National Health Service. So we're planting huge numbers of trees in NHS sites. And if you want to learn more about that, look at the Centre for Sustainable Healthcare NHS Forestry page and learn about what's been going on there. There's also a great guide on how you can plant a healthy garden within your health practice. So say, for example, you happen to have a general practice with a little allotmenty bit to it or some garden to it. You could plant plants in there that help to promote bee life and pollination. And actually, what was one surprising fact to me is that all of the private gardens in the UK are far greater than the protected areas of the whole of the United Kingdom. So all of our private owned garden spaces have the potential for making really positive impacts to biodiversity if we all decided to keep these places and use ways of encouraging them rather than monoculture lawn. That can have a really positive impact on insect and mammalian life. So yeah, we can make changes that can help promote that.
Amazing.
And I just wanted to say thank you to both Amarantha and Rosie for taking time out of their busy schedules to come talk to us about this. Join us again next week where we'll have the second half of this episode. Thank you for listening to Dragon Bytes.